Hi there, I'm Dr. Matthew Schulman, board certified plastic surgeon here in New York City, and let's talk about what you should be eating after your surgery. So you've just had cosmetic surgery. Maybe you've had a tummy tuck, maybe you've had liposuction or breast implants or a Brazilian butt lift. The procedure you had really doesn't matter. Let's talk about what you should be eating. In general, you just want to be healthy. So you want to make sure you're eating healthy foods with lots of protein and avoid things like sugars and highly processed foods, which is really what you should be doing anyway to be a healthy person. Now you have to be careful because after surgery, you may not feel like eating much. You're going to be nauseous. You're going to have medicines that you have to take like antibiotics, pain medicine, maybe a medicine for nausea. So you're going to have pills that you have to take, which means you just may not feel like sitting down and eating a salad or a steak or a big meal. That's okay. So what you want to concentrate on is having small, more frequent meals. So instead of having breakfast, lunch, and dinner, you're going to have something like breakfast and then a small snack a few hours later and maybe lunch and then another snack. So that is because you're just not going to be able to eat very much. Again, you're going to be taking medicines, you might be nauseous, your stomach's going to be full, maybe you just had a tummy tuck and everything's tight and you just can't fit any food in your stomach. It's okay. So keep those meals small and just eat them more frequently. But the main thing here is it's okay if you don't feel like eating. It's totally normal to not have much of an appetite after your surgery. In fact, most people don't feel like eating that much for the first 3 or 4 days. Again, it's okay. Don't force the food in because you're just gonna get nauseous and you're gonna throw up and you're gonna feel terrible. So I promise you're not gonna get malnourished or you're not gonna lack nutrients or vitamins because you're not really eating for the first couple days. You just do the best you can. Keep the foods light. Most people find that spicy foods or really heavy foods just don't sit well in their stomach after surgery. So you want to keep it light. You want to keep to things like maybe eggs or soups or toast with jelly, just really easy, gentle things on your stomach. The other thing you want to be careful of is to avoid salt. Salty foods will make you swollen. Some of you may experience that now, or if you have a salty meal, your fingers get swollen, your rings feel tight, or your ankles get swollen, and your shoes feel tight. That's pretty normal, and salt does that to a lot of people. After surgery, it's going to make it even worse. So you want to make sure if you are eating soups, you get low sodium soup so that you don't have all that salt, which is going to make you more swollen. Avoid things like chips and cold cuts like processed meats like ham and bologna, salami. Those are really high in sodium, so you may not think you're having a lot of salt because you're not sprinkling the salt on, but foods like that are naturally high in salt. The main thing here is because you're probably not going to be eating much is you want to drink. You want to drink liquids. You want to make sure you don't get dehydrated. So that means drink a lot of water, but don't be afraid to drink things like Gatorade or Powerade or Pedialyte. These are all liquids that are going to give you electrolytes and give you some nutrients which will help get you through the healing process while you're probably not eating very much. The other thing that some patients do is they really try to push the protein. And since they're not able to eat a lot of protein-rich foods like steaks and things like that right after surgery, they'll take protein supplements like shakes. That's okay, but again, just be careful and listen to your body, and you don't want to force food or drinks into your body to the point where you get nauseous, because that's gonna make you feel terrible and it's gonna defeat the whole purpose. So just make sure you're drinking liquids, and when your appetite starts to come back, just eat healthy. I'm Dr. Matthew Schulman, and if you like videos like this, which are designed to help educate you and help you through your recovery process, make sure to like, comment, and share.